Okay, we have finished our BodyTite RFAL procedure. We went through the approach to zones, the approach to access ports. We did deep to superficial. We got to our cutoff temperature, and we aspirated a gentle aspirate, which in this patient who had previous liposuction was really quite a very nice feature and benefit of RFAL. After the procedure, I like to close my ports, and then I put all my patients in a compression garment, especially when we're trying to get skin contraction, and this is the optimal thermal experience. That skin's going to contract and settle down over the next 6 to 12 weeks. So we take an external compression garment and facilitate and assist that contraction process. So as you can see, our patient is cooperative because she's awake. It's an outpatient ambulatory oral sedation experience. We've done our contouring. I'm going to get our operating nurse to come in now, and I'll just show you the Epifoam or the Topifoam, the foam that I also like to use. And this is an additional compression feature. We'll take this foam, it's got a nice silicone backing, and we'll place that over the contoured zone, right over that outer thigh, trochanteric area, contoured zone, and that'll facilitate the compression. They'll wear this foam for the first 5 to 7 days, then stop using the foam and just go pure garment for another 2 weeks. So 3 weeks of compression garments, about 22 hours a day, and then for the last 3 weeks they can wear the compression garment during the day and leave it off at night. So let's go ahead and put that compression garment on. And while they're doing that, let's talk about post-operative care. So post-operative care really depends on the practice, but there's some basic principles. Give the patient some type of narcotic. There'll be some discomfort, not much. Some patients will do this type of BodyTite treatment and only use extra strength Tylenol or maybe an ibuprofen. Some will require narcotic type analgesia, so give the patient some options. Some are more tolerant of discomfort than others. I tend to use a prophylactic antibiotic at the time of the procedure. A simple cefazolin, second generation or third generation cephalosporin, and some keep that antibiotic going for some days. I generally give 1 dose. Patients are then instructed to keep active immediately. She'll walk right out of the procedure room and be up and active today and tomorrow and until we see her back for her suture to come out. The sutures come out on day 5 or 6 depending on the intertriginous zone, and at that time we show patients how to move the foam around. They can start having showers. For the first 6-7 days it's sponge bathing to keep clean. She can be quite active. She can go for brisk walks. She could be on a stair climber, on an elliptical. Nothing with high impact, though. Anything that causes a shear force on the skin will be not good for the contractile force that's happening. I also don't like to use strong non-steroidal anti-inflammatories. We want to set up an inflammatory process. We want those inflammatory mediators from the thermal experience to stimulate myofibroblasts and collagen production. So I don't use strong anti-inflammatories. Most patients find this very comfortable. Most patients have almost no bruising. Most patients are back to moderate activities of daily living the next day. And most of these patients now in my practice do this under local anesthesia, a non-IV sedation, non-general anesthesia. Again, if you're doing multiple sites or large volume aspiration where you've got to monitor fluid output and intake, keep patients overnight. So I think that this has been a nice illustrative case of the BodyTite procedure, of the advantages of RFAL, and I hope you're able to incorporate this into your practice and you find it a tremendous benefit to your patients. Thank you very much. So why don't we go ahead and allow Michelle to get up and go to the side office, and Michelle, we'll see you back in a few days, okay?
Okay, thank you so
Are you having
much.
much pain now?
No, not at all.
Perfect.
Well, this got on, it felt a lot better.